I've asked Susan Stewart, a leading New Mexico geriatric care manager with Decisions in Care, to help me understand the importance of selecting your geriatric care manager. So Susan, how do you locate a care manager in your loved one's area?
A geriatric care manager can be identified through the National Association of Professional Geriatric Care Managers. The website is caremanager.org.
And what is the benefit of choosing a care manager through the National Association of Professional Geriatric Care Managers?
It would ensure that the individual receives a care manager that has a minimum amount of training and experience, and it would also ensure that the individual has the proper certification in care management or licensure that would enable them to provide effective services. There is a code of ethics and standards of practice that is required to be followed by each care manager that is a member of the National Association of Professional Geriatric Care Managers.
What questions should people ask when they interview a care manager?
It would be helpful to know what the primary services are that are provided, if the services are medically based or more of a social service focus, what the person's credentials are. Are they a nurse? Are they a certified care manager? Or are they a social worker? You would want to know if they are certified or licensed in their profession. Also ask if they're a member of the National Association of Professional Geriatric Care Managers. You would want to know how long they've been providing care management services so that you would know the extent of their experience. You would want to also know if they would be available after hours and what can be expected. In some situations, there's an additional cost for after hours response, and you would want to ask about that. You would want to know how they most effectively communicate, if they prefer to communicate with you by email or by telephone. You would want to know also what their fee structure is. And this should be provided in writing to the individual prior to signing up for services.
How important is it to ensure that the care manager is a good fit for the family and for the person in need?
I believe that it is very important because the issues vary from the individual of what they feel is important, maintaining their autonomy, being able to continue to remain in their home for as long as possible, and the focus of the family is going to be possibly different, wanting to make sure that the needs are effectively met, wanting to make sure that their loved ones are going to be safe. I think also it's important to shop around until both the family and the individual that's going to be receiving the services is happy with the individual that's going to be providing the care management. So don't stop until you shop and are satisfied with the person that's going to be serving you.